Learned helplessness is a psychological condition where a person comes to believe they have no control over their environment or outcomes, even when they do. This belief typically develops after repeated experiences of failure, disempowerment, or lack of choice, and it often leads to passivity, low motivation, and a reluctance to try new things. For people with developmental disabilities, the risk of developing learned helplessness can be especially high due to well-meaning but overprotective care, environments that offer few choices, or experiences of being repeatedly told what to do without being asked what they want. Over time, individuals may stop attempting tasks they are capable of doing and instead rely entirely on others, not because they can't, but because they believe they can't. For direct care staff, it's essential to recognize the signs of learned helplessness. A person may frequently say, "I can't," or refuse to engage in activities they've successfully done before. They might seem unusually withdrawn, passive, or dependent, even in situations where support isn't needed. It's not uncommon for staff to mistake this behavior as laziness or non-compliance, but often it's a reflection of past experiences where attempts to act were either unsuccessful or ignored. Recognizing these behaviors as indicators of learned helplessness shifts the focus from blame to support and creates opportunities for empowerment. Learned helplessness doesn't just show up overnight. It is typically the result of long-term patterns in relationships and routines. Repetitive exposure to environments where individuals have little voice, where decisions are made for them, or where mistakes are met with criticism rather than encouragement, can reinforce the idea that trying is pointless. For people with developmental disabilities, many of whom already face communication challenges or physical limitations, this sense of helplessness can quickly take root if their autonomy is not respected. Over time, they may stop attempting to speak up, explore, or express their preferences, reinforcing the belief that they are incapable or undeserving of choice. As care professionals, the way we structure daily routines, offer choices, and respond to behaviors has a profound impact on whether someone experiences empowerment or helplessness. Supporting independence doesn't mean expecting someone to do everything on their own. It means giving them opportunities to participate, decide, and try, knowing that mistakes are okay and that support is always available when needed. It means fostering a can-do environment where success, no matter how small, is acknowledged and celebrated, and where individuals are seen as capable, growing people rather than passive recipients of care. To counteract learned helplessness, we must create consistent opportunities for meaningful choice and participation. This includes offering alternatives, even in small tasks, like what to wear, what music to listen to, or where to sit at lunch. Just as important is how we respond when someone hesitates or says, "I can't." Instead of doing it for them, we can break tasks into manageable steps, offer encouragement, and give them time to try. Shifting from a task-oriented mindset to a person-centered one allows us to focus not just on getting things done, but on helping people build confidence and skills. Progress might be slow, but every effort matters. Understanding the roots of learned helplessness also means reflecting on our own actions and systems. Are we unintentionally rushing through routines and skipping opportunities for the person to participate? Do our rules and expectations sometimes limit individual choice? Sometimes it's necessary to advocate for changes in organizational culture or routines that prioritize efficiency over autonomy. Promoting dignity and self-worth starts with asking, what can this person do for themselves with the right support? And then building from there. Consider the case of Abigail, a woman with developmental disabilities who moved into a group home after years in a more restrictive setting. At first, Abigail refused to get dressed without help and wouldn't touch her food unless someone fed her. Staff were concerned about her lack of ability, But one support professional noticed that when Abigail was left alone with her lunch for a few minutes, she began to eat slowly on her own. Instead of rushing in to help, the team began encouraging her to try small tasks with coaching and positive reinforcement. Over time, Abigail began dressing herself and even started choosing her outfits. What once looked like inability was actually a pattern of learned helplessness, unraveled by patience, encouragement, and a belief in her capacity. Recognizing and addressing learned helplessness isn't about doing more. It's about doing differently. It requires a mindset that values growth over perfection, voice over compliance, and potential over past behavior. As direct care staff, you have a powerful role in shaping how someone sees themselves and what they believe they can do. Every time you invite someone to try, praise their effort, or simply ask what they want, you are helping to dismantle helplessness and build a life rooted in self-worth, autonomy, and possibility.